Go.
Good morning. My name is Kristen Sanderson, and I am here this morning with Samantha Kriegshauser. She is the director of the Fort Mill TKK Adult Enrichment Center here in Fort Mill, South Carolina. Ms. Kriegshauser, how are you this morning?
I'm doing just fine, thank you.
We have had a presentation so far on how to deal with Alzheimer's and dementia and the different forms. And now I'm coming to Ms. Kriegshauser for some tips on caregiving about dementia. Ms. Kriegshauser, if you could give us any specific advice on how to caregive for a family member with dementia, what do you have for us?
Well, the first thing is, if you have a loved one who's been diagnosed with dementia, that you need to be aware of that fact and slow things down, okay? They're processing information as quickly as they can, but we tend to speed things up, talk quickly, make decisions quickly, and an Alzheimer's or a dementia brain moves at a much slower pace. So the first thing I tell caregivers is to speak slowly and allow the person time to process the information as much as they can.
Okay. What do you do if you have a person, a loved one, who's been diagnosed with dementia, who gets very agitated on a daily basis? How do you deal with that agitation?
Well, it depends on finding out the cause of the agitation. A lot of times it's just because they're confused and they're fearful. So if we can get them some regularity in their schedule and give them a routine, sometimes that brings the anxiety down. A lot of times it's because you're in their space and they become paranoid. So backing out of their personal space and giving them time to react slowly can help decrease. And then eventually, most dementia clients do end up on some form of medication to handle that anxiety because the brain is shutting down. And so things that we could normally handle on a normal functioning brain, we can't process. So we give it some medication to help them be able to do that without becoming combative aggressive.
Now, in my former presentation, I had tried to differentiate between vascular dementia and Alzheimer's. Is there anything you can add to the differences between the two?
Think of dementia as a giant umbrella, and underneath the umbrella are several different causes. Vascular dementia is one cause. Alzheimer's is only one cause, but it is the biggest, the leading cause of dementia. Vascular dementia occurs when the brain is deprived of oxygen, which we see a lot of times after a person's had a CVA or a stroke, after a traumatic brain injury where the brain was deprived. And vascular, while it has a lot of characteristics that overlap with Alzheimer's, does not necessarily progress in the same way that true Alzheimer's does. So there is a big difference, but there are numerous other causes. There's a medication cause, Parkinson's-based dementia, a Lewy body dementia. There's a dementia specifically for MS, for people with Down syndrome. So there are many causes under that giant umbrella, but Alzheimer's is the leading cause.
Okay. Now, you're a dementia dialogue specialist. What exactly is Dementia Dialogues?
Dementia Dialogues is a program based out of Arnold School of Public Health, USC, Columbia, South Carolina. And Jan Merling is the creator of that program. And what it does is it enables us to learn communication tools for people with dementias, to understand the process of the disease, the medications, and then we take it out in the community and we use that to help caregivers, to help family members, to be able to care for their loved one and understand this frustrating process of dementia.
Okay. Well, one last question. If we have recently had a family member diagnosed with dementia, what would you say is the best way to begin to cope with this?
My first thing would be I would find a doctor who specializes in dementia, and there are more and more geriatric physicians who are doing that. Your family physician is fine, but to combat this disease and to understand it, my first recommendation would be to find a geriatric specialist who focuses on dementia or Alzheimer's care.
Okay, and what about support groups?
There are support groups. There are a number in this area. I highly recommend them. Caregivers need a lot of support to be able to get through this process and stay focused. They also need respite. 24/7 caregiving is the #1 cause of secondary illnesses in the caregiver, so that escalates the cost on the family. So getting a support group and having that support in place is vital.
Okay. Ms. Kriegshauser, thank you so much for your time today. It's been a pleasure.
Thank you.